Hi everyone, welcome back to What's Up Doc. Before this next video, I need your help with something. I am trying something new. I've created a little Google form to get your opinions and ideas, and I'd be really grateful if you would click on it and fill it in. Hi, welcome back to What's Up Doc. I'm Dr. Michael Cohen, I'm a family medicine specialist. Today I wanted to discuss the very important subject of mental health and how people who come to see a family doctor present, and also what the reason is for so many people coming to present with mental health problems in the last few years, and what is the way in which we assess these issues, and also what can we do to try and help before jumping into using medications, which unfortunately has become a very common practice over the last 15 to 20 years, I would say, especially in the Western world, but also all around the world today. So let's start with how somebody actually comes to the clinic. A person may come feeling low, they may be very stressed, and all doctors, especially family doctors and obviously psychiatrists, know full well that there are a number of questions that need to be asked to assess a person's state of mind, to find out how seriously they're suffering. So we ask questions about their day-to-day routines, about their sleep, about whether they're waking up very early in the morning, whether they are sleeping too much, what their appetite is like, what is their mood like in the last couple of weeks. What are their activity levels like? Do they enjoy things? And if they don't enjoy things, how often do they not enjoy things? And how much are they able to come out of this situation on their own? So, as a family doctor, we tend to see mainly, number one, stress, number two, depression or low mood, number three, anxiety, and often a mix of all of that. Obviously, we do see other types of mental illness, and we see people with so-called eating disorders, and I say so-called not lightly. I say it because I think that we could be using a more creative name for an eating disorder, because people are not suffering purely because of the existence of food. And those are the main things I would say that we see. Of course, there are other presentations of people becoming psychotic and having drug-induced psychosis. There's a whole raft of different diagnoses that we see. Ultimately, I see a person in front of me and I see them suffering with something, and the symptoms that they have is an expression of that suffering. And I think that it's up to me to try to understand who is this person sitting in front of me, what they're going through, what their family circumstances are, what's going on with their job, what's going on with their social life, what is their level of risk, which is crucial to figure out. Are they someone who has no social ties and is having very dark thoughts of harming themselves? Or do they have a very good social network and they're able to express themselves well, and they're able to reach for support when they need it, and they have the physical health to be able to do that as well? So these are the kinds of things that we look at when we assess a person. Well, I think first of all, having a circle of friends or close family is crucial for anybody. We're not islands, human beings. We all exist and live within a community. I think one of the reasons why it's so prominent in my mind is, especially in my generation, having grown up in the 70s and 80s, when social connections were very much more easy, and I think people liked social connections more compared to now, where a lot of things happen through mobile devices. People are connecting through mobile devices. The recent COVID pandemic, maybe the ongoing COVID pandemic, hasn't helped matters much with that. It's only made things worse. The that this focus through, looking through the camera of a phone and seeing somebody on the other side, it has its uses for sure. But in terms of social isolation, I think it only magnifies it. I think the irony is that we have these devices, we have the internet, and that the idea of all of this in the beginning was to connect people, to make everything more connected. And in fact, what it's done in many cases is isolate people, because a lot of people today feel a lot of anxiety just connecting on a real social level. And I'm talking about children, talking about adolescents and adults. And I think that there needs to be a balance, there needs to be a shift in the balance, and that this in itself could improve mental health across a whole array of problems that we're seeing today. In terms of, if I was to take depression for a moment, I think that a large part of the problem that people are experiencing is actually one of loneliness. And that doesn't mean that they never see anyone around them, but the actual connections with people seem to become more distant. And if you just take the example that if today you walk out in the street and ask someone the time, they might give you a slightly odd look, and as though, well, you've got a phone, you should know the time. Or if you ask for a direction, or if you want some piece of information, it's almost like everyone wants to be connected, desperately wants to be connected, and at the same time, when the opportunities occur, it's almost odd that people are actually making connections. So I think that this only serves to isolate people. I think that clearly people can make connections, and it's all very well and good using FaceTime or WhatsApp or Facebook. These things do have functions, but from an emotional point of view, as human beings, we are social creatures. We need interactions. We need physical interactions. Friends need to hug and meet, and not just talk over mobile devices. I see so many people who no longer even talk over the phones because it's just more convenient to text. And I think that this is one area that we really need to take very seriously, also especially with young children who are becoming so accustomed to devices that they feel anxiety around getting into real social situations. So that's how I see the situation at the moment. I also think that in terms of when I see a patient in the clinic, well, one of the things that's actually very important when anyone comes, whether it be for a physical ailment or a mental health ailment, is actually to examine the patient. And that means even it may be the most basic thing, like checking somebody's pulse or checking their blood pressure or listening to their heart. Whatever it be, the physical examination has a therapeutic benefit. And I think that this is something that sadly, because of technology and the rush to investigate people with tests, whether they be blood tests or x-rays, these are also ways in which we can distance ourselves from our patients instead of listening well, listening actively, and then going forward with some kind of a management plan. But that should involve at least a very basic physical examination. The doctor-patient relationship has a lot of potential. I think that we don't always utilize that potential. And if I compare things to when I was a medical student and a young doctor, which is some 25 years ago now, to how they are today, I see that the technology has advanced, and it seems to be pushing us away from, again, from physical examination, from listening, from thinking, from engaging. I think the role of a doctor could be so much more than what it currently is. Medicine today has become very technical. I remember when I first became a doctor, in my first year I was working in the emergency department, and they just introduced a protocol for identifying people who may have a blood clot in their legs. And the whole idea was to streamline them through the system. so that it would involve minimal human contact. So basically, people were filling in a questionnaire, and this was being done with a healthcare worker or a nurse. And I remember seeing people who, through this questionnaire, you should have been able to determine, is this a blood clot, or is this a high risk of it being a blood clot or not? And I saw people who were treated for a blood clot, and then it turned out that a particular question wasn't asked in the right way. And in fact, what they developed was a huge bruise in their leg, which could actually threaten their limb, because no one had considered the possibility that jumping off the back of a lorry can injure your calf muscle, which can cause a tear in the muscle and bleeding. And then if you give someone a drug to anticoagulate, to thin the blood, you actually worsen the situation dramatically. And so this was a very clear example to me of how people don't fit into neat categories, and as doctors, we need to be able to communicate in the best way possible. We need to be able to listen very actively, very attentively, very sharply, and that there are a lot of nuances in the doctor-patient relationship that I think could be lost through technology today. I think that in the modern world, with the amount of extra medical knowledge that we now have, it's very difficult to go back there, because there is so much more information that we are supposed to be putting together and utilizing for the benefit of our patients. But I think that we're also losing something by thinking that we can solve everything through some technology, whether it be a pill or whether it be some other more advanced treatment. I think that many problems that come to that present to doctors, many patients who present to doctors, could be made a lot better off with some pretty simple advice, with a warm smile, with attentive listening, with reassurance. And the fact is that it's so much easier to write a prescription. It's so much easier to send someone for a blood test, just in order to manage their symptoms or problem, rather than to get to the bottom of it. So I think we should be, as doctors, really trying to get to the bottom of things. And something that all doctors would say is that in medical school, we were all taught that the diagnosis of a patient is about 90% made through the history, meaning speaking with the patient. And the 10%, which is the physical examination, while it's incredibly important, is really not the whole point, meaning you can't substitute a good conversation with an X-ray or an MRI. There's much more to people than that. And it's very easy to over-investigate people with technology and over-treat people, and actually cause them harms or miss important facts in their diagnosis. And I can think of so many cases of this having happened in my own experience, whereby someone just hasn't asked the right questions and has gone straight into doing tests and treatments. One case that comes to mind of a few years ago, when someone close to me was actually taken into hospital after their relative called me, and this person was he had a kind of a gastroenteritis, so had vomiting and diarrhea, had a fever, and went to the hospital and gave the story that he thought, well, he'd eaten this sausage in a Christmas market, and essentially this was the cause. And so he was put on a course of antibiotics, and I went to see him in the hospital, and I spoke with him just for an extra few minutes, and I understood that the story was slightly different. In fact, the week before he'd gone to that Christmas market and eaten that sausage, he was given a course of antibiotics for a bronchitis, for an upper respiratory infection. And he didn't realize this, and the doctors didn't make any connection, didn't ask him, probably because they were rushed. And so he was essentially put on an antibiotic that made his situation much worse, and he could have ended up in the intensive care unit. Just by listening to the history and recognizing this, he was switched on to the right treatment, which involved actually stopping the antibiotic that was now making his situation much worse. So this was a very clear example of how just taking time to listen, speaking, cajoling, understanding can make a huge difference. I think that family doctors are classically supposed to be the ones who take everything into consideration. I think all doctors should take everything into consideration. But because family doctors tend to develop a long-term relationship with patients over many years, I think that patients have a slightly different expectation of a family doctor. They regard them more as I don't want to say friend, because it shouldn't be a friendship. There are boundaries, but definitely as a kind of a guide in their life, a steady presence who has seen them through good times and bad times. And I think that also, to come back to what we spoke about earlier, I think that a family doctor probably has the potential to be a little bit of a psychologist, a little bit of a philosopher, a little bit of a priest, a bit of a confidant. And I think that when we mix in all of these disciplines together with appropriate boundaries as well, that really we're in for a winning combination of trying to improve the health of our patients. I'd really like to hear your opinions about this video. I'd love to hear what your experiences are like with your doctors. I tend to think that it's a mixed experience. I hear people who have wonderful things to say, and I hear people who have less wonderful things to say. And I'd also like to engage you to ask you, what would you think you could do differently to get your doctor to be more engaged if you think that they're not as engaged as they could be? Very often I hear people complaining about their doctors, and while that's all well and good, I tend to think, well, what is a constructive way to get your doctor to work better for you? How can you, let's say, aid them in helping them to help you? So thank you for watching. I look forward to our next video, and I'm looking forward to your comments, and I hope you will subscribe as well.